What is Dientamoeba fragilis? Have you ever wondered how tiny organisms can affect your gut health? Today, we are diving into the world of intestinal parasites, specifically Dientamoeba fragilis. This parasite is part of a group called flagellates and is often found in human stool samples. Most commonly, it appears in a form known as trophozoite, though some rare cyst-like forms have been noted. The role of Dientamoeba fragilis in human health is still being researched, with cases of both asymptomatic and symptomatic infections reported. When it comes to symptoms, Dientamoeba fragilis can cause issues that feel a lot like irritable bowel syndrome, colitis, or even appendicitis. People infected may experience bloating, gas, diarrhea, and abdominal pain. If you have a sensitive stomach, these symptoms can be particularly distressing. The presence of Dientamoeba fragilis can lead to inflammation in the intestines. This inflammation may show up as elevated levels of calprotectin, a protein that indicates intestinal inflammation, in stool tests. So, how do we treat Dientamoeba fragilis? The most common approach is using antibiotics like Metronidazole. However, not every case responds well to treatment, and some infections may linger despite standard therapies. Interestingly, eliminating Dientamoeba fragilis can sometimes relieve symptoms that mimic those of irritable bowel syndrome. Yet, the exact connection between this parasite and gastrointestinal symptoms is not fully understood. For those dealing with sensitive stomachs, irritable bowel syndrome, or colitis, it is essential to consider intestinal parasites like Dientamoeba fragilis as a possible cause of discomfort. While not everyone infected will show symptoms, it can still contribute to gastrointestinal issues for some individuals. Therefore, if you are experiencing persistent symptoms that resemble those of irritable bowel syndrome or colitis, it may be worth investigating the possibility of Dientamoeba fragilis. When managing bloating and gas, especially for those with sensitive stomachs or conditions like irritable bowel syndrome and colitis, it is vital to look at all potential causes. This includes intestinal parasites like Dientamoeba fragilis. Good hygiene practices can help prevent infections, and consulting healthcare professionals is essential if symptoms persist or worsen. Understanding the role of Dientamoeba fragilis in gut health can aid in developing effective strategies for symptom relief and overall gastrointestinal management.